Good morning. Happy Sleep Wisdom Wednesday. That's my new name for what these lives are every week. Today, I want to talk about the thyroid and how that affects our sleep. So this is the last week of getting into the nitty-gritty science of why you aren't sleeping. So let's do it. Thyroid problems are so common. Millions and millions of people are diagnosed with thyroid problems. And then there's so many more who have symptoms, but are told that they're normal. So we're going to get into why that is. The synthetic form of thyroid hormone is the fourth highest selling drug in the US. So that's what a big deal our thyroid issues are right now. And studies actually show that 90% of people with hypothyroidism, so that's an underactive thyroid, are producing antibodies to thyroid tissue. So that means they have an autoimmune disease. And the autoimmune thyroid disease is called Hashimoto's. And it's the most common autoimmune disease in the US. So this is a really big deal. Now, a little brief kind of how the thyroid works. It is a gland in our throat. Our pituitary gland releases the thyroid stimulating hormone, or TSH, when thyroid hormones get too low. And then the thyroid produces T4 and T3. It mainly produces T4, about 80%, and just 20% T3. But your body has to convert T4 into T3 to use it throughout the body. And there are thyroid receptors in every single organ, every single part of our body. So the thyroid kind of works like a thermostat in our house. So when the thyroid makes the right amount of thyroid hormones, it keeps the temperature just right. But if the thyroid is overactive, which is hyperthyroidism, it's making too much T4 and T3. And it's like having a thermostat that's set too high, and so the house gets overheated. This is definitely going to cause insomnia because you're just too energized. You have too much of this hormone. Now, if your thermostat isn't active enough, then it's set too low and the house is going to get cold. And that's called hypothyroidism. And a lot of times symptoms of this are, it can cause insomnia for sure. A lot of times insomnia is caused from other reasons, which we'll get into in a minute. But, a sign of hypothyroidism is actually sleeping a lot and still feeling sluggish and tired all the time. And I find this is the most common when people get their thyroid tested by their doctor and they're told they're fine, but they don't feel fine. They know that something is wrong. And, this may be you too. You may even still have a lot of the symptoms of hypothyroidism, which are, inability to lose weight, even with diet and exercise, feeling cold all the time. Those are some hair thinning. Those are some of the big ones. So if you're having those symptoms and you're told that that everything's normal, then that's really frustrating. So let's get into why that might happen. So first of all, standard lab tests come back with what they call a normal range. And so your ranges might show, again, that you were normal. But these ranges are actually based on sick people who are getting these lab tests done. No healthy person is walking into a doctor and saying, I want my thyroid tested. So the ranges are based on the extremes of hypothyroidism or hyperthyroidism, and then calling anyone in the middle of those normal. But there is a huge, gigantic difference between normal and optimal. And so that's what's really cool about the training I've done, is knowing what the optimal ranges are. So we don't want just what's barely passing as a D-. We want, an A+ optimal range. So it's also, interpretation of these tests is huge. Now, there's also a really common issue that these tests don't test for everything. So a lot of I talked to someone recently who's got a blood draw at the hospital, and they just test for TSH, that thyroid stimulating hormone. And her hormones were low, so then they, prescribe her hormone replacement. But that's not necessarily solving the problem, and it's not looking at the big picture. So we also need to test for T4, and then many labs don't test for T3 at all. But again, since our bodies need to convert T4 to T3, and that conversion is often the problem with my clients, then you're not getting the big picture. So I like to see it as, say you're trying to ride your bike and your bike will not pedal, right? And if you only look at the pedal, you're not going to figure it out. You have to look at the entire system, the chain, the cassette, the cables. You need to look at everything that could affect the pedal and not just the pedal itself. And so to me, that's what these tests are, of just looking at TSH and not everything. It's not going to identify the problem. So doing the right test is really important as well. Now, I also want to mention how connected the gut is to the thyroid, because this often gets overlooked. And again, if you're told you have thyroid issues and you start treating your thyroid, but you still have an underlying gut issue, then it's not going to get better over time. It's like, being in a boat and bailing the water, but water just keeps coming in. So you have to fix the leak, right, to actually repair the boat fully. So it's the same here. If you don't address the gut issues that are contributing to the thyroid problems, then you're not really going to get better. The reason why the gut is so important is that our gut bacteria, our healthy bacteria, make the enzyme that converts T4 to T3. And if you have any kind of inflammation in the gut, which I've talked about as far as having a parasite or having leaky gut or having food sensitivities, if you miss those videos, then definitely go back and take a look at those, because I've talked about all of those and how they affect sleep. So if you're having inflammation, which is then going to raise cortisol levels, that's going to also decrease your T3. And so that's going to affect how your thyroid is functioning. So you've got to treat the gut as well as treating the thyroid to get to the bottom of it. And so just adding those synthetic hormones isn't going to help in the long term. I hope that helps explain a little bit about the thyroid. I know so many people, women especially, who are, get tested and they're told that everything's normal and they don't feel normal. So if that's you, please get in touch with me and we can talk about, how we can do some more comprehensive testing to figure out why you aren't sleeping. Because the way I see it, you're not sleeping is your body telling you that something is wrong. And it could be many different things. And so that's why I look at all these factors of thyroid and hormones and gut health and food sensitivities and everything to get to the root cause of why you aren't sleeping. So please message me if you have any questions, and I will see you soon. Thanks for listening.